As you can see on the side of the screen, all of my study social media handles are there. I'll flash them up again at the end if anybody wants to take a photo. But just to start off then with a bit of an overview of what I'll talk about today. So I'll give you a tiny introduction to autism. For anyone who's seen Trump's latest nonsense, it is not caused by paracetamol. There is not any high quality evidence of a link. I'll also talk about 3 key areas that autistic people are different to non-autistic people. So that's in communication style, sensory processing, and also pain. I'll then bring it together with a little bit of an overview of experiences of maternity care. I did one of these talks, I think last year or the year before, that has more detail on that. So you can go back and watch that online if you want some more detail. And I'll finish off by thinking about putting it into practice and giving you a whole load of resources. And you can see on the side of the slide my book, which is due out next month. And actually the copies arrived this morning in the post in a huge box, which is very exciting. And my publishers have given us a 20% discount code, which is on the bottom there. And I'll pop that up again at the end. So thinking about autism then. We used to have the label autism spectrum disorder. That isn't used so much these days. If you're diagnosed today, you would get a diagnosis of autism. And we've gone away from this idea of a disorder or a condition, and instead we think of it a bit like being a different operating system. So like most people might run on Windows, autistic people are a Mac. You know, we're different, we're not worse. As I showed earlier when I was updating my slides, I can't use a Mac. It's completely okay to be whichever one you are, but it is just slightly different. Now, one of the things you will often hear about autistic people is their distress behaviours. A child bangs their head on the floor, screams, runs around the house, is inconsolable. You might hear about autistic meltdowns, and these are distress behaviours. Luke Bearden has something that he calls his golden equation, and that is autism plus environment equals outcome. Those distress behaviours are the outcome. If anyone can think back to GCSE maths, it might have been a really long time ago, you know that you can manipulate what's on one side of the equation by changing the other side. So if we make the environment around autistic people better, they will have less distress behaviours, the outcomes will be better. And I think it's really important to say that many autistic people flourish and experience significant joy. I'm autistic, I've got a great career. There are many, many autistic midwives because they get really into maternity care after having their own children. But it can be really disabling to be autistic without accommodations. And under the Equality Act, if you're providing maternity services within the NHS, there is a legal requirement for you to provide reasonable adjustments. And by reasonable, we mean something that isn't too expensive or too difficult to deliver, but small things can be made as part of usual care. So let's think about our first difference then. So the first thing I'm going to talk about is sensory processing. Most people have heard of the 5 senses. So we have sight, hearing, smell, taste, and touch. I always need to put it on my slide so I remember. And autistic people can have differences in their sensory processing. It's one of the key things in the diagnostic criteria. So sometimes we need more of some senses. So people might feel dysregulated, autistic people, and they might be doing things that give them sensory input. So that might be, I always talk about Deborah Meaden, fiddles with her fingers on Dragon's Den. That is a stim. Stims can be any kind of repetitive thing. It can be humming the same song. It can be listening to the same song, watching a favourite TV show over and over again, or anything to do with your body, moving your body in a particular way. Many autistic people have low interoception, which is on the bottom of the slide, and that's your internal bodily sensations. So that is where you are in space, how hungry and thirsty you are, these sorts of things. So many autistic people actually like being in water because that tells you where your body ends far more than air does. Moving back up then into being less sensory needing or sensory avoidant, autistic people can find lights very bright, noise is very distracting. It can be like hearing 17 different things at once being in a clinical environment, because they might be able to tune into each individual one, but that takes a lot of brain power to do that. So autistic people can be both seekers and avoiders of sensory things, and we know that pregnancy increases sensory sensitivity. And as I've mentioned, we have these other sensory systems as well, so vestibular, proprioception and interoception. And these are less known about, but they are different in autistic people as well. Things like balance, you know, when you get more heavily pregnant, that can be thrown off, that can be quite difficult for autistic people. Even feeling their babies moving inside them can feel really horrible, like nails down a blackboard, so you know your baby's alive and it's good for that reason, but it can be really, really uncomfortable. So that's our first difference. Our second one then is communication. So autistic people tend not to do so well with euphemisms, sarcasm and indirect language. So they just might not quite understand it. But we know that it's polite to nod along and to smile and to say, yeah, that's fine. So actually clear and direct language is always the best if you have autistic people you're supporting. Also, communicating can take more energy or just be impossible at times. We know autistic people find speaking on the phone difficult. One of my favourite papers about autism and healthcare accessibility is called Anything But the Telephone. It is literally, you know, needing to be on death's door before your phone to make that appointment. If you could email or you could book online, if you could send a text message to your midwife, that would be so much easier. Eye contact is often harder and even painful for autistic people. And often we don't really see the point in small talk. You know, we would get straight into something of interest. I really love what you're wearing because that person has an interest in fashion. Or talking about pets is often somewhere where I find common ground with autistic people. Now, I mentioned that the sensory environment can be difficult, it can be painful, hearing those 17 different sounds at once. And this can impact on communication. Because if you think we've all got a certain amount of processing speed, and if a good chunk of your processing power is taken up blocking out those sounds to try and listen to the one conversation you're in, then actually that slows everything down, like having dozens of tabs open on your very old NHS computers. I don't miss that part of working for the NHS. And this can just make it harder to speak. So as well as knowing what they want to say, it can make verbally speaking more difficult. Around a third of autistic people don't speak or sometimes are unable to speak, and they might use something like you can see on the side of the slide. That is known as augmentative and assistive communication, or AAC, and they're apps. You can get them on your phone. I've got a couple on my phone for when it's difficult for me to speak. People who use them all of the time might use an iPad because then you can get more on one screen at once. People might also have cards that, you know, laminated cards or even cards they've made themselves that they might carry around and they might show you them. And even making a list of things on a piece of paper and giving you their questions or their symptoms. Also, this is something that's come up in my research, is people's partners or parents or whoever is coming along to appointments with them speaking on their behalf. And this can sometimes be a domestic violence flag, but actually sometimes that might need to be an accessibility thing for the individual. So, you know, do the check that you need to do. Ask them if you feel comfortable that actually their partner is speaking as an accessibility aid. Maybe that could be something added to their notes so it doesn't need to be retested every time. So those are some differences in communication. So moving on to my third difference then, and that is pain. I teach our midwifery students at Swansea University, and this is something that they're always really interested in. So research a decade or longer ago used to talk about how autistic people had higher pain thresholds. They could take more pain. And it's very similar to the research we used to see about black women. Black women didn't need pain relief because they were absolutely fine. Now we know that there aren't actually any inherent differences. So autistic people tend to have a similar level of pain overall, but they can also be hyper and hyposensitive. Thinking back to that sensory slide, touch is one of the things. For some autistic people, a gentle, reassuring hand on the shoulder could feel awful. They might rather have a vaginal exam than that gentle hand on the shoulder. It can be really different and it's very individualistic. So some things might be much more painful than you might expect. Some they might not feel the pain so much. One of the things that's come up in my research recently is that people aren't sure if they're in labour. They aren't sure, is this a contraction? Because it might feel weird rather than painful in the beginning. Even though there aren't overall differences, autistic people can present their pain, their external expression of pain can be quite different. They might also find it hard to say when the symptoms started. You might then be encouraging people to maybe keep some notes, like WhatsApp themselves if something's going on that they might want to tell you about. They might say that their pain is higher or lower than you might expect for a particular thing to happen. And I would say just treat that as a reliable. If they can have more pain relief, give more pain relief. They might also struggle to describe their pain. And I have seen something, and I've completely forgotten the name of it, but it's a list of about 70 different adjectives that describe pain. So if you do have a lot of autistic women coming through your service, you might want to have a look at something like that. And also, as I mentioned before, severe pain can mean people stop being able to speak. Even if they've been fully able to speak the whole way through their maternity care, challenges during birth might just mean that speaking has ended. So it might be good to think about alternative ways to communicate during those later antenatal appointments, just in case. We also have some research that autistic people find 1 to 10 pain scales harder to use. Is it a 6 or is it a 9? I don't know, it's a lot. And there's some evidence that pain scales that have like smiley faces up the side of them as well, coloured from green all the way up to red to go with the 10, can make it easier to describe their symptoms. So we thought about those 3 core differences there and just a brief overview of what this means in maternity services. So talking about what it was like to be in hospital, one of my participants said it was sensory hell, and a lot of them found it really difficult. The noise, the lights, the ultrasound jelly, all of it felt difficult. With communicating, they often felt the need to mask, which is kind of pretending to be non-autistic to reduce how much people will dislike or bully you. It's something that many autistic people develop throughout school and childhood, but actually in a healthcare consultation, there can often be a feeling of needing to mask because actually you need to get the thing that you need out of it. There isn't another option often for treatment. Many of my participants felt that they weren't listened to during their maternity care, and 10 out of 193 talked about literally being about to deliver their baby and not being believed. And then eventually someone would have a quick peek and go, oh God, and a flurry of activity happened very quickly. One gave birth in reception with their husband catching the baby because they'd just been sent away because she wasn't in active labour. He was about to go and get the car. It was very lucky that he just came back in time to catch the baby. Pain was often undertreated, and this included when getting stitches after birth. Several people talked about the stitches, even having gas and air taken off them at that point, which doesn't feel very kind to me. A big issue was also often that our participants hadn't given consent. So a third said that they didn't understand how things were explained to them. And it was just over half said that they didn't get the option to say no to examinations or to treatment. So I would say they're thinking this sensory environment, it's busy, it's loud, it's overwhelming, that you might want to do something more like enthusiastic consent that we see in sex. So I'd like to do an examination of you now. That would involve me putting on some gloves, some lubricating gel, and then I'll put 2 fingers into your vagina. It'll probably take around 30 seconds. Does that sound okay? And waiting for them to say yes, or to ask the questions, or to agree with you. If I tap you on the shoulder, you will immediately take your fingers out. You know, we need to think about how we can get consent working better there. And altogether, our participants felt that the health professionals they saw in maternity services didn't understand autism. So it's great you're here today and you're getting some information, but they were also really realistic. They said there were a lot of barriers to giving good care. The ones who talked about good care often had continuity of midwife. Some of them went through specialist mental health services, even if they didn't have a mental health diagnosis. So if there is an option in your area for somebody to go through a mental health pathway to get continuity of carer, that might be really valuable for autistic people. Because overall, many of our people said they had a really negative experience of their maternity care. Some felt really traumatised, some decided they wouldn't have more children because of it. So we had a lot of real difficulties there. So let's put this all together then. These are my take-home points for you. If you think you might have autistic people in the future, you might want to take a photo, save this somewhere, key points of things you can do. So clear and direct language, ask specific questions, and give specific instructions. So that's both when you're about to do something, describing it, but also if you need them to do something. So instead of if you have any bleeding, give the unit a call. How much bleeding? If you see any blood at all in your knickers, I'd like you to phone the unit. If you see more than a few drops, it's really urgent and you really, really must do that as soon as possible. You know, be really clear. Listen and believe the individual, particularly around pain and also if they might be about to have their baby. And ask their preferences. They might not tell you, they might not think they're allowed to have those preferences. If you have any control over the way your maternity service is run, set up your clinics to maximise communication with autistic people. So that would be continuity of carer, allowing extra time in appointments, and allowing their partner to speak for them if needed, obviously within your own safeguarding policies. And in general, offer non-touch options and never touch without asking and then getting that consent first. And you might agree with them that they can just nod to give their consent after the first time. You know, that they don't need, you know, you can say it's going to be exactly the same as the last time I examined you. But work with them to agree that. And having said all of this, it's really important to know that a lot of autistic people won't be diagnosed when they're coming through maternity services. So many women and girls get missed at school. And so they often then have an autistic child because there's a genetic component, and they then get diagnosed after their child has been diagnosed or their children. So those are my key tips for you. Here is just a big bundle of resources for you. So this presentation was based on 3 articles, one on maternity care, one on pregnancy loss, and one on breastfeeding. And there are summaries of the maternity care and breastfeeding papers on The Conversation. They're about 800 words. So they might be good if you have autistic people coming through your services. Also, just another little plug for my book, and the discount code is there again. And also I worked with lots of autistic maternity professionals, so midwives, lactation consultants, occupational therapists, an anaesthetist, and autistic parents, and we created 114 short videos. I started off thinking we would have 7 animations. When we did what everyone suggested, we got to 114 short videos. They're up on YouTube on autism, menstruation to menopause. Do use them, do recommend them to people. We've got videos for almost everything. There are some things I'd still like to have made, but yeah, we'll add to them in time. And then just to finish off, here are my social media handles again, if anybody needs them. So thank you for your time.